We pass it over now to Chief Medical Officer Anita Martin.
Good afternoon. I just want to tell you a little bit about the coronavirus. It is a viral illness, and the way it presents is with fever, cough, and shortness of breath. Most people will get that symptoms, and most people will do well. There are emergency symptoms, though, if you have trouble breathing, worsening shortness of breath, persistent chest pain, or pressure in your chest, blue lips or blue face. Those are emergencies, and that requires immediate medical attention. Most people younger than 60 will do very well with this illness, unless you have a chronic medical condition, diabetes, lung disease, heart disease, kidney disease. That puts you at an increased risk, and being over the age of 60 puts you at an increased risk. At this point in time, there is no treatment for this, there is no medication, and there is no vaccine. So the only way that we have to protect people is to avoid exposure. And in light of that, what we've decided to do in the clinic, starting today, tomorrow or today, we will start calling people who have scheduled appointments to reschedule you for a different time. So that way that we can protect you from being exposed to people who have respiratory illnesses. And we are also setting up a hotline that you can call us if you have questions. And that number is 701-627-7641. That line will ring into our clinic, and any of the nurses or providers will pick up and answer any of your questions. If you are sick, think you've been exposed to the coronavirus, COVID-19, or you just have questions, please call that. We ask that you call before you come into the clinic, especially if you think you've been exposed or have the virus, so that we can tell you what to do. And arrange so that if you need to come into the clinic, we can meet you at the door, give you a mask, bring you back in, and not risk exposing other people. If you have minimal symptoms, then what our recommendation for you is to stay home. Don't go out. Isolate yourself. And I did have a question about testing. We will have the ability to test for this particular virus. The state has put restrictions on who we do test, and before we can test anyone, we have to call the state epidemiologist to review the case with him. So we have the capability, but not everyone who walks in will be tested, and only those people who are really sick, have exposure history, or need to be hospitalized are usually the people who will be tested. And that's where we are right now, because the number of tests available in the country is limited. And so they are limiting to the people who need them. And I think that's all for me. Oh, the hotline number is 701-627-7641.
And we will post that on our Facebook page as well.
Okay. Thank you.
And now we'll pass it over to Public Health Nurse Marilyn Yellowbird.
Good afternoon. I just want to go over a couple of key things you want to remember to not infect yourself or others. Okay, for keeping your household safe, make sure you clean your hands at the door. If people have, if you have the hand sanitizer, go ahead and do that right when you walk in the door, especially if you're coming from work, and do it at regular intervals. Try to make it a habit to not touch your face. I know it's difficult, and cover your coughs. Put your face into your elbow. Don't cough into your hands. If you do use a Kleenex, make sure you throw that Kleenex away quickly. Do it right away. Don't set it on the desk. Don't do anything like that. Just take it and throw it right away in the trash. Disinfect all the doorknobs, especially the doorknobs, your refrigerator handles, your stove handles, anything you touched. Make sure you disinfect your tables, your doors, things like that. Sometimes you can, if it gets a little bit nicer, sometimes it's easy to just open the doors and ventilate, but I know that's not It's kind of difficult here in North Dakota. If you have a person who has any underlying condition, again, heart, lung, kidney disease, or diabetes, you want to make sure that person has their own room possibly, if possible. Limit the amount of people that are going to take care of that person. If they're bedridden, make sure maybe one person in your household is able to just go in there and take care of the feeding, take care of the linen, that kind of stuff. Don't have everybody doing it, and I understand that's difficult to do, but that's what we're asking right now. You're trying to protect the rest of your family as well as the public. Make sure the utensils and everything that they use are properly washed. I would take just a small bit of Hylex, put it in your dishwater when you're washing the dishes. Regular laundry washing for the clothing and the bedding that's all you need is just regular laundry washing. Okay, keeping safe in the workplace. Make sure that obviously I know it's tough to do, but we do need to stop shaking hands, and I know that's like the chairman said, that's difficult for us in our culture, but we do need to stop shaking hands. A smile is as good as a handshake is what my mom always said, so we're going to have to start doing that. Cleaning your hands at the door. Taking those little hand sanitizers with you to work. Wipe off your computer, the whole computer. Wipe off all the buttons. Wipe off anybody who's using a phone. That needs to be cleaned on a regular basis. Wiping off your desk. Again, limiting the amount of people that come into your office. If you're in a place where you have a lot of people coming back and forth, they can definitely talk to you through the door. Just limiting that amount of traffic through your office, and taking disinfect all your handrails, disinfect your tables and desks, that kind of stuff, and again, cover your face. Use video conferencing for meetings. Like the chairman said, we're going to definitely go back to electronics now. Limit your food sharing. If you're taking your lunch to work, you guys have a central place to put your food. That's one thing you're going to have to make sure, and put everything in plastic. Don't share your food with other people. Don't take out, and probably not having the potlucks anymore, probably things like that. We need to just limit those to a certain extent. Avoid travel. Okay, I hate to say it, and I hate to say it for all the elders, but the casino is one of the largest vectors for spread of viruses. So those machines, you don't know how many people have sat down and touched the machine to play it. So just FYI, make sure you take your hand sanitizer with you. Maybe wipe off the machine before you start playing. Ensure that the cafeteria staff have all the clothes contract to practice strict hygiene. If you are feeling sick, stay home, please. That's all we're asking, is just stay home. That is the best way to increase the safety for your family and for the rest of the tribal members. In closing, I just want to say, in the late 1900s, there was a virus called the Spanish flu. It nearly decimated Northern Europe. It also was here in the United States. It decimated the reservations. One of the things that was investigated was a public health practice. One of the things they found out was washing hands. That actually eradicated the Spanish flu because people started washing their hands. Now, that's all we have to remember for this. Don't get excited. Don't panic. Just wash your hands. Keep washing your hands on a regular basis. And that's all I have to say.
Okay, thank you very much. We'll turn it over to the law enforcement, Mike Roy.
Good afternoon. My name is Sergeant Mike Roy with 3 Affiliated Tribes Law Enforcement Services. The main thing I want to stress is that everybody remain calm. We have adequate law enforcement services here to handle this situation. For the most part, it is medical, but we work hand in hand with the medical services and emergency services on a daily basis. Many of us are also trained and certified in FEMA's ICS system, the Incident Command System, whereby we're able to go and evaluate an emergency and get those resources assembled and to the location as quickly as possible. So, we have police officers from all over the country with a variety of different backgrounds. I come from South Florida, where I've dealt with a number of emergency incidents, mostly hurricanes. We're prepared. We're prepared to do what we need to make sure that we can coordinate our efforts and our resources, get those resources out, and make sure that people are safe here. And I just want to make sure that everybody understands. We also have, if we were to need them, we have resources through the BIA, through the federal government, through FEMA. And in a lot of cases, we're able to utilize and coordinate with the county, local, and state agencies. So you can always give us a call, 701-627-3617, 701-627-3617. And you can also make sure that you check the home wellness checks. Yeah, we can also do home wellness checks to make sure that we can answer any of your concerns. You can call and always ask for a wellness check if you have a relative, or especially somebody who has been identified by our medical personnel as a vulnerable person. Those people over 60, and I think she mentioned, those people who have underlying conditions. So there's also a state hotline, which they said once before, 866-207-2880, and of course our hotline here for the MHA Nation, 701-627-7641. And I just want to remind you, you all have police officers who live in your neighborhoods. In the community I live in, you can give me a call. I can direct you to the appropriate resources. I can also respond. And we have this thing under control, and as a community, we'll get past it.
Okay, that was such good information. Thank you all so very much. Ms. Yellowbird, Ms. Martin, did you have anything more to add, or?
Not go to state number, that's all.
Okay, yeah, and once again, those numbers that they had given us was the number here for the Newtown and the Port Berthold area was 701-627-7641, and the state of North Dakota hotline number was 866-207-2880, and we will have those posted on our Facebook page and our websites as well. And the law enforcement number, as Mr. Roy gave us, was 701-627-3617. And again, we will have those posted on our website.